Presentation objectives. The first presentation objective is that the student will be able to list 3 negative impacts of a shortage of experienced nurses by the end of the presentation. The second objective is that the student can list at least 2 vital roles an experienced nurse fills in the healthcare profession after reviewing the presentation. And lastly, the student can list 4 or more reasons why experienced nurses report leaving their positions by the end of the presentation. What's the issue with a shortage of experienced nurses? Zhao, Li, and Chen noted that experienced nurses are the entire backbone of the nursing team in a hospital. The nursing profession has a plethora of obstacles to overcome. Long hours, mental and emotional stress, and increased workloads are all things that contribute to nurse burnout and turnover. Due to the high rate of burnout documented in this profession, many nurses change positions frequently and can leave the field, which leads to a shortage of experienced nurses. In a research study, Wan, Li, Zhao, and Shang, 2018, noted that 35.9% of experienced nurses had high-level turnover intention. Reasons experienced nurses leave their positions. Due to the vital importance of experienced nurses staying in their positions, several research studies have been dedicated to finding out the factors that contribute to experienced nurse turnover. This slide shows some of the factors that experienced nurses reported as reasons for turnover in the nursing profession, including higher patient acuity, increased workload demands, ineffective working relationships among nurses and with physicians, gaps in leadership support, and negative impacts on nurse health and well-being. What is the influence on nursing practice? Having experienced nurses in acute care settings and in the field altogether is a vital part of the learning and patient care processes. With a limited number of experienced nurses, the number of qualified preceptors and mentors is inadequate, thus leading to a poor orientation process for new graduates. A research study by Bowden, Brodus, and McNett, 2018, also noted that there are increased incidents of patient safety issues such as falls. The impact on healthcare. As noted previously, lack of experienced nurses can increase the occurrence of harmful events. Many of these events, such as falls, can cause higher costs for hospitals. Drury, 2014, noted that in a study by the Columbia University School of Nursing and Columbia Business School, research highlighted another cost on healthcare that can occur with the lack of experienced nurses, which is an increased length of stay for patients and higher rate of readmission. Lastly, lack of experienced nurses shows turnover within the healthcare business. What is the impact on society? The shortage of experienced nurses has many impacts on society. These factors that affect nursing practice and healthcare, in turn, affect our patients and our population. Our population is the one that suffers by being victim of these increased rates of patient safety issues, as well as putting them at risk for an increased length of stay in hospitals, as well as readmissions. The lack of experienced nurses can also have an effect on prospective nursing students and those that want to join the field. What can we do? Hayward, Bungay, Wolfe, and McDonald, 2016, stated, evaluation of current retention strategies is needed to ensure they target the unique complexity of the experienced nurse in clinical settings and address daily practice issues. Overall, more dedication needs to be put into researching and implementing retention strategies. By doing so, the healthcare field can increase job satisfaction in nurses and increase the number of experienced nurses staying in the field. Zhao, Liu, and Chen, 2015, stated, considering the challenges health services are facing and the demand for qualified nurses, it is essential to promote the well-being of the experienced nurses in order to retain them. Experienced nurses are leaders and teachers as well as experienced caregivers who offer their knowledge to better the newer nurses. With an inadequate amount of experienced nurses, we not only jeopardize our patients' care, but also the future generation of nurses.